The shoulder is one of the most complex joints in our body. It is made up by the upper arm bone, the top of which forms a ball, and the shoulder blade, what we call the scapula, and an extension of the scapula that forms a socket called the glenoid. That's called the glenohumeral joint, which is the shoulder joint. Above the shoulder joint is what we call the AC joint, which is made up of this part of the shoulder blade called the acromion, and this bone called the clavicle or collarbone. And that's why it's called the AC joint or acromioclavicular joint. The shoulder joint is considered a ball and socket joint, although the socket only surrounds about 20% of the ball. That makes the shoulder joint an inherently unstable joint, which means it can easily dislocate in cases of trauma. There are several ligaments that help stabilize that joint, and also muscles and tendons that help keep the ball centered on the socket. The four main muscles that do that are the rotator cuff. You have one in front called the subscap, one on top called the supraspinatus, and two in back called the infraspinatus and teres minor. These four muscles coalesce to form a tendon that attaches to the top of the humeral head and is called the rotator cuff. There are several ligaments that help stabilize the AC joint. You have the AC ligament, which attaches the end of the collarbone to the acromion, and you also have what's called the coracoclavicular ligaments that attach the undersurface of the collarbone to this projection of the shoulder blade called the coracoid. One or all of these ligaments can be damaged in the case of an AC separation. Lining the ends of the bone is a special type of tissue called articular cartilage. Articular cartilage is what creates that smooth gliding surface when the joint moves. The cartilage can become damaged in a localized spot, or it can be damaged more diffusely, and that's what we call arthritis. What is not shown on this model is the long head of your biceps. Your biceps is a muscle that has two attachments. One is called the short head and attaches to the tip of the coracoid. The long head goes in this little groove and actually goes over the ball to attach inside the shoulder joint, and that's called the long head. The long head can frequently be damaged because it has to go over the ball every time you raise your arm and can sometimes dislocate out of the groove. There's a structure deep inside your shoulder joint that surrounds the rim of your socket called the labrum. The long head of the biceps actually attaches to the top part of that labrum. Other ligaments that stabilize the shoulder also attach to different parts of the labrum, and in cases of a dislocation, the labrum can be torn, which makes the ligaments more loose and can lead to recurrent instability. The labrum serves an important role to deepen the socket, and as I mentioned, is a point of attachment for important ligaments. On top of the rotator cuff and below the acromion is a structure called the subacromial bursa. Bursas are thin sacs of fluid that cushion tendons or skin as they glide under or over bony prominences in your body. The large one in your shoulder is called the subacromial bursa. Every time the arm is raised up, the tendon glides underneath the acromion. Normally there's hardly any fluid inside the bursa, but sometimes that bursa can get inflamed and can get pinched when you reach your arm up or across your body. Hopefully this presentation helped you to understand your shoulder anatomy better. You can always refer to our website for additional information.